I'm Hollie Heikkinen, founder and CEO of iWorker Innovations. I don't know how all of you feel, but I am super excited to be here today. I think this has been an awesome day, and some really great and invigorating and energizing presentations have definitely taken place. For me, it's very exciting to be around so many thought leaders, innovators, and people who truly care about serving others and bettering lives, lowering industry costs, improving technologies, and ensuring fairly rated healthcare for all. A few of you know me, but for those of you that don't, I have 4 children, 3 of which are now adults. And throughout my journey of parenting, I often found it best to use laughter and as a way of explaining the potential cause and effect of my children's decisions and choices that were sometimes potentially negative. And every now and then, when one of them would get a little bit sassy, I would snicker and say, "You better be nice. I'm going to live to be 100 years old." And it was truly a joke then. I didn't really think that I would ever live to be 100 years old, but I must say that after being at a conference like this today, hearing what is actually taking place, how we're using blockchain and how we're using the data to try to find ways to truly better lives, encourage better care, and lengthen people's lives, I think it's possible that it's true. I might live to be 100. So I want to thank each of you that are in here today that are the experts, visionaries, and innovators in the industry. With your contributions, I think it's definitely possible. So what am I doing here at a conference like this? As the CEO and founder of iWorker Innovations, which is actually a national insurance brokerage and a platform as a service company, one that is actually backed by Prudential. Attending a conference that's focused on blockchain and telemedicine and health. Well, I'm here among service providers, tech providers, and associations like you for a reason. I'll be very candid. I'm here to find solutions for the tens of millions of people here in the United States, the ones that are working independently. I call them often the invisible ones. They're the ones that don't have a centralized benefit structure. They don't have a political voice. They don't have worksite protections. They basically didn't, until recently, have anyone out there advocating for their behalf. I'm here to make sure that these types of people have some of the technologies that I'm hearing that are actually being created or in the process of already being used, that those platforms and those technologies could have another relevant application. A lot of times I'm hearing people talk about employers and the employees. Some of these technologies are actually very relevant to this independent workforce. We just have to find access to get to those types of workers as well. So I'd encourage each of you to think about that. How could you take whatever your company is working on and apply it to getting into the independent workers' lives as well? So I'm here because I believe that within every one of you and your companies that there's a potential partnership to be made. I believe that it could be a mission between each of us to collectively fulfill our corporate social responsibility as companies. I believe for many of us it is our just human desire to create things that would better serve lives. And I would ask that each of you and any of you that would have any interest in talking to me about how we could partner up, how we could take what you're doing and apply it to the independent workforce that I'm serving, to come up to me today and to connect. A part of this mission has already begun and is being fulfilled through my partnership with the first association in the country to be national, to serve not only somebody's work type, but their work style, and that's that of an independent worker. With that, I'd like to introduce Dr. Carl Camden, the former CEO of Kelly Services, a Fortune 500 company, and the co-founder and president of iPSE-U.S, the Association of Independent Workers.
Glad to be here very much to talk about this. I'll talk about it a little differently than my tech friends do, but I will talk about some outcomes that I think are critically important. One of the things that we don't talk about very often at the various healthcare conferences that I go to are the independent workers. There are 22 million of them who make all of their money this way, and I'll go on to say that they would not choose a employment position even if it was offered. There's another 12 million people who make most of their money this way, and they say that they plan to get to the place where they make all of their money this way. We're talking about 34 million workers in this country who are psychologically and monetarily committed to the workforce of the future, I believe, of independent work. And yet, when I come to the healthcare conferences, what I most need to hear is how the healthcare professionals, the providers, the advocates, and the healthcare-oriented policymakers, I don't hear them talking about how are we going to close the gap to providing healthcare services to every person in this country, not just those who are fortunate enough to have a job or who are wealthy enough to be able to purchase out on the individual market. What I don't hear at these meetings is an outrage at Supreme Court decisions that make it impossible for associations to offer health plans to their members. What I need to hear from the healthcare community is an equal commitment, not only to providing better healthcare services, but also an equal commitment to not leave people behind. So when Hollie asked you to join us as partners, I'm looking for you all to join us as partners in advocacy for the uninsured, the uncovered, those who can't afford to pay the expensive costs that often individual policies rather than group-rated policies have. And so with IPSE, we are advocating for these independent workers, and there are several forms of discrimination that we wish to end, but I will tell you that number one in their list is always access to health care. Because in this country, and this country alone, of all of the OECD countries, chooses to say that as a country, we've made a policy decision that says you might have to go without health coverage. You may have to put yourself up on the emergency room. You may have to not participate in the same preventive medicine that others provide because we chose to tie it for employment. And of all the groups that I would expect to be our natural allies in defending the rights of the independent worker, I would expect it to be the healthcare community, which is one of the 4 largest communities that deploys independent workers. Your hospitals, your clinics, the emergency rooms are all staffed by large numbers of independent workers across the country, and it's important for us to stand up for that community elsewhere. But blockchain gives me hope, especially when we talk about the horizontal integration of blockchain. I think that we can get to the place, not just of saying that we have secure medical records, not just to the place where we say that we have their data protected so that it's going to be secure, but why can't we also say we get to the place with the use of blockchain, with the use of blockchain technology combined with that horizontal integration to determine what are the most cost-efficient ways to provide healthcare service? What are the ways that produce the best collective outcomes, not necessarily the best individual outcomes? How do we use the power of your data to make it possible for government officials, to make it possible for states, to make it possible for state governments to be able to expand the reach of the healthcare system rather than what we face today, which is every year there is a smaller percentage of people who are covered by health insurance in the United States than there were the year before. We should be ashamed. Countries who have GDP, a fifth of the United States in terms of GDP per person, provide health care insurance as a function of citizenship. We are the only country that makes it a function of how you choose to work. And so I will speak gladly at every gathering of healthcare professionals saying, we need to work together so that at every one of these conferences, at every one of these meetings, we say to ourselves, what are we doing to increase the population of those who can access health care? What are we doing with our new technologies to drive down the cost? What are we doing to predict problems in advance? How are we going to use the amazing new technology? How are we going to use it as it combines with other healthcare treatments to be able to provide proactive advice to everybody so we can drive down the cost? And so I say that the challenge is not just one of better technology. The challenge is not just one of data privacy, but the challenge for every one of us should be to fulfill the oaths that were taken when you became medical professionals and serve the population and make it possible so that nobody goes home not knowing what happens if they get sick. Thank you. This one.
Well, I'm sure we all echo those sentiments. Thank you very much for that. And I will tell you that from my perspective, I've 40 years doing what I thought was important in IT. Everything changes. So I'm 6 years after getting cancer, right? So I was lucky enough to have that and survive. To this day, when I just had a CT scan 2 weeks ago, right? And I'm still waiting for the results. And I got the prior authorization approval after I had the CT scan. So why is that? Well, that's because of privacy restrictions and rules and all these other kinds of things. So our focus, company focus, my mission, the legacy here, is to make sure that those barriers to getting information out to the patient is effective, efficient, and goes from point A to point B. It's really that simple. So what happens in between there is where the waste comes in healthcare. So waste in healthcare comes from uncertainty in healthcare. Uncertainty is generated by someone not knowing what to do next. I was at an EHI conference where the head of utilization management for United Healthcare said that 50% of the calls approximately that come into their call centers are doctors trying to figure out if they're going to get paid or not. It's uncertainty. All those phone calls, right? Every patient that doesn't get a call back, right? What do? Like, you call your doctor. There's nobody there to answer the phone, so they call you back and get your voicemail. All that is waste in the system. It goes on repetitively over and over and over again. So Haven's mission is quite simply to reduce those interactions, tie these systems together in a way. And blockchain, the only thing we're using it for, the only thing it does is sits in the middle and makes sure that without any company having to disclose all of their information to another party, there's just enough there to allow communication. I mentioned in the talk this morning, the number one inhibitor, the dirty secret that no one wants to talk about, is that no one really wants to exchange PII. Blue Cross is not going to disclose to a hospital system who their members are. And the hospital isn't going to disclose to someone else. And it just goes on and on and on again. And yet we talk about interoperability. So the way to do that, and the advantage for us with a blockchain setting, is that you don't have to. The only thing you need to be able to do is create that connection. There is a video. Is there a... If not, I won't. I'll just keep on moving here. All right, so we echo this same thing about this being a force and a place for change here. So it's inspiring to hear these kinds of stories. You people are doing wonderful work. We'd love to partner with you. And it is going to take this this is an uphill battle on the blockchain thing. And we will cross the chasm and get to where we need to be by us working together. So thank you very much for that. And we look forward to the rest of the day.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, advancing digital health together. iPSE-U.S, the Association of Independent Workers, for one, for all. Partners in Digital Health, publishers of the forward-reaching blockchain in Healthcare Today and Telehealth and Medicine Today. Special consideration to iWorker Innovations, taking the independent workforce to new heights. Connected Health Conference, designing for healthy habits and better outcomes. Haven Health Solutions, providing true blockchain transactional interoperability. Special thanks